Yeah, but I don't need a physical therapist. Physical therapist is not typically part of my medical team for personal injury. Most of the rehab in low impact soft tissue spinal injuries, we can easily do. Physical therapist is really, I mean, you're talking about major trauma, not a low impact soft tissue spinal injury.
So if you're doing your rehab in office, are you doing the manual therapy code for that?
Yeah.
Okay.
I've never referred to a physical therapist. I never had enough of an injury. I mean, you're talking about a pretty significant injury if you're sending them, to a physical therapist. That's not a low impact soft tissue spinal injury.
Okay.
Yeah, the typical medical team is pain management. I like to send them to pain management just for medications, anxiety, pain pills, muscle relaxers, another team member, another professional's involved. And if you want to do any trigger points or anything like that. And then if you have a radiologist, especially a medical radiologist, that's good. Or if not, a chiropractic radiologist, instead of you reading everything. And then I always use the neurosurgeon for the spine and the disc, not the orthopedic surgeon. You'll find neurosurgeons are way more friendlier to chiropractors. They're more involved with micro movements. They really appreciate the 3 phases of healing in scar tissue, because scar tissue is 50% of back failed surgery syndromes. So when I explain the 3 phases of healing and collagen, type 3 collagen and the matrix and physio and the lines of stress, they love that. They're like, they've never heard it. They've never heard anybody talk like that. They love that. That's how I won over my medical profession for referrals, is the 3 phases of healing. And then I use orthopedist for extremities. They got a shoulder issue, if I can't handle a knee or a shoulder, then I'm going to send them to an orthopedist. And then their neurologist, any neurological symptoms, I'll send them to a neurologist for their opinion. A neuropsychologist for behavioral testing for the mild concussion. We actually have one. I'm going to be doing an interview with her in the next week or two, a neuropsychologist, and I'm going to have her come on and explain what she does and how she does it. But that's what's used, in addition to the FDA approved blood test, that's what's used for mild concussions, is a neuropsychologist that gives behavioral testing. And then obviously if there's a fracture, that's an orthopedist. But that's the medical team. That's all for a low impact soft tissue spinal injury. That's all you need. It does not include a physical therapist.